Go ahead and call the meeting to order. We have 7 members present, 2 absent at the current time. We do have a quorum. Before you is item number 2 on our agenda. I'll try to talk into this mic a little better. Is there a motion to approve our minutes? Motion by member Solner. Is there a second? Second by member Metzger. Any comments or questions, additions, or corrections to the minutes? If not, all in favor, please say aye. Aye. Opposed? The motion's carried. Appearance by members of the public. We've had one member, our county clerk, Kathy Michael, apply to appear to speak as a member from the public. Welcome, Ms. Michael, and you're, I guess we're going to put you down there on the end. You have the floor at this time. What do we have? 5 minutes for committee speakers, don't we? Okay, thank you.
Thanks. I just wanted some clarification, and I understand Ms. Taylor's going to be offering some clarification on that bill, the motion that was voted no on at Finance regarding distribution of recovery funds. Did I understand you correct, Ms. Cassie, I wanted to call you, that you're going to offer some clarification on that?
I hope to have the opportunity.
Okay, and I sent an email individually to each one of you, kind of describing that, so I won't take the time to go into that. But just briefly, as we all know, and was it 31 million or 33 million? 31 million that the county got from the Recovery Plans Act. And a portion of that, which we discovered, can be given out as bonuses to essential workers. And there's a formula and everything. It's very detailed. And we went through all these details to do it with spreadsheets. I think there's a misconception, perhaps, that this money is, I've recently heard, is quote unquote doled out to every employee, and that is not the case. It has to be very well defined. And there's formulas then that amounts can be determined up to $25,000. And we certainly don't anticipate asking for that, but we ask for you to reconsider this process and not say no to offering bonuses to essential workers during this most critical and challenging time. I can't imagine if you revisit and do more research on the issue to get the details, you'll see that this is a very fair allocation. I know when I spoke months ago to administration, things hadn't been determined yet. And it was talked about, perhaps 5,000 for essential workers, perhaps more, perhaps less. Nothing had been determined. And then finance, which for me, I don't mean to make this an excuse, but it was hard for me to understand. I hadn't done any homework to read the details of that bill, and I did not understand it anyway. That was on the agenda. And then to see that vaccinations were tied into the meager $1,000 out of 31 million. I just need more clarification because it's disturbing to me. I hope this can be revisited and that essential workers, I did speak with another county board member who indicated that all workers in the county should be paid something, and thus it wasn't fair just to give county workers. While I respect everyone's opinion, my first thought is, so we're going to deny county workers because they're county workers and not everybody gets money? You know, that's not the issue. We're given money, we're given guidelines for it. I'll work with somebody if you want to work to get everybody in the county money that is an essential worker, because everybody deserves it, everybody. But we have these funds to give bonuses to essential workers, and I would ask that you strongly consider making this happen. And that's all. Thank you.
Okay, thank you. We'll move on to Departmental Matters Executive Committee. I have one appointment for you, Chinoa Fire Protection District. Mr. Underwood, is there a motion to approve? Yes, it is. I'll try to lean here a little closer. Is that better? Is there a motion to approve the appointment to be passed on to the board. Motion by Member Schaefer, second by Member Woolrab. Any comments or questions? If none, all in favor, please say aye. Opposed? Motion's carried. We'll go into the report of finance. We have our Behavioral Health Coordinating Council report in there. Ms. Malat is unable to attend today. I do. Oh, I'm sorry. We do. Okay, so we have an action item for request approval and agreement with CLA from Information Technologies. Is that correct? Is there a motion to approve? Motion by Member Martin, second by Member Woolrab. Comments or questions? Member Metzger.
I do have a question, and I would think that maybe Craig may
He's
be
on his way up
required
here.
to answer this,
He's
but
on his way up here, and I apologize for missing that.
no,
on our agenda.
it's fine. The proposal, and I certainly believe a pen test is something that our organization should be doing, vulnerability assessment, certainly I support this. My only question is that this organization said that they rely on the organization's policies, procedures, and documented standards to define the accepted standards of operation. Have all of our, prior to doing this, have all of our policies, procedures, and documented standards been made up to date?
No, but we are in the process of doing that. So the auditing, external auditor is also CLA. This is a separate branch of them. And they noted that we had some standards that were not formalized. So we've been making a concentrated effort. We have about 17 of those put in place internally now. And so this is part of, we wanted to get one in still in this year. And so we wanted to do this one with where we're at now. We know there's going to be findings that we're going to have to address. But then we want to have that baseline to compare against next year when we come back to the pen test again.
I understand your direction. I'm not sure that it's not a lot of money. I understand that too. It's what, $6,700. I'm just not sure that not having our procedures, policies, and standards ready for them is going to, the outcome will be even worse than what we would expect, I would think, and that's my concern. So,
We're actually hoping to glean some direction in the formation of those policies and standards as an outcome of the process.
and who helps review those to make sure that they are at industry standards?
So we follow standards that are set by the Center for Internet Security, CIS, and also there's a NIST standard framework that we try to conform to. And so those are the two frameworks and set of standards that we try to tie to.
I did notice that one of the things that they said they would do is use previous vulnerability studies and pen tests to assist. So this will be our first one, and then you're anticipating another one then 1 year from now, or 6 months from now, or when we get these procedures complete? Where are we at on that?
The recommended best practice is to do this annually. So I would hope to come back again next October. October being part of Cybersecurity Awareness Month, yay team. But I would hope to bring it back again a year from now. Probably use a different company. We'd like to alternate companies in order to get a different perspective each time that we go through the process.
Do you think a year is too long of a period of time?
Not for the penetration testing itself. Now we do perform, we have weekly vulnerability scans that take place against our system. and those are provided from the feds. And we get that information in weekly as part of our security. And so that's a very high level, looking for very obvious attack vectors that could be used. The penetration testing is quite a bit more intense. Someone comes on site, becomes kind of in the organization, and they'll attempt to socially engineer our employees as well as we'll give them a basic user account, and then they try to see how far up the system they can get from that user account.
And how many employees do we have working from home that we can check our VDN?
Well,
VPN.
the number of employees we have working from home is pretty small at this point. We do have, I don't know how many we have full-time at all. That would be more of an HR question, but we don't usually have more than 5 or 6 connections concurrently running at any time.
They do want to check that, so I guess my recommendation would be that we make sure that we have people that are working from home, that we can validate those things, because as we know, anytime we could all be back working from home, and making sure that our VPN meets all the standards, and it just meets the standards, but prevents any penetration that we don't want.
That's a fair point. At the height of the pandemic shutdown, we were running around 60 concurrent connections at any time during that. So.
Okay, thank you.
Mhm.
Are there any other questions for Mr. Nelson at this time? Mr. Solner?
Thank you, Mr. Chairman. Will this disrupt the rest of the organization at all? I mean, will it be something that will cause other people, will you need to shut other people's systems down, or I guess my question is, will it be disruptive?
That was one of my questions as well. So we did a pretty lengthy call with the Unit 5 technical staff who had this done for them as well. And we also had a conversation with CLA. It will not be disruptive to the staff here.
Okay,
So while they see what they can do, they don't execute anything malicious that would actually impact the organization.
okay, thank you.
Thank you. And are there any other questions, Mr. Nelson? Not, I'll call the question. All in favor of item C, please say aye. Opposed? The motion is carried. We'll go on to item D, Behavioral Health Coordinating Council. There's 2 items for action. If there's no objections, I'll combine D1 and D2 because they are both approval to be accepted as providers, both Molina and Meridian, so that they're able to bill for our fuse and triage programs. Is there an objection? If none, I'd entertain a motion to approve both items. Motion by Member Schaefer. Is there a second? Second by Member Metzger. Are there any comments or questions about that? Member Erickson?
This is completely unrelated, but it's probably the best spot to bring this up. The Rules Subcommittee discussed the Behavioral Health Coordinating Council and whether it should be taken out of exec and moved over into the Health Committee. And I had said at that meeting that even though we don't have to address it tonight, I said I'd wanted to hear Chairman McIntyre's view on that before we made a decision. So when the Rules Committee comes back and does that again, I hope that we could get the chairman's opinion before then, so.
Sure, be happy to do that, and we'll discuss it at that point in time. Thank you very much. Anyone else? Member Woolrap?
Are these the only options we have for getting Medicaid, Medicare payments? That's my understanding what's going on here, right?
Yeah, they have to be accepted by Medicare as providers for them. Are there other options? Boy, I think there might be some other providers, but I'm not sure in
Let
this
me just-
case because it's specifically for behavioral health
Behavioral, I
and
was
services that are available that provide for us, yeah.
asking because it's my understanding that at least in the past, we've had significant issues getting payment from Molina for our nursing home. And so, it may be another completely different arm of the company, but nonetheless, I just wondered, how that might
You have
affect this.
So I do believe that these 2 companies are common in our area in working with our Medicaid population And so that is why you will see their names across several of our organizations with these efforts. I do believe that there are other companies that the behavioral health director is looking at applications to see. Obviously, the more well-rounded you are in having contracts with all of the companies that serve this population, the better off that program would be. But these are the most common serving this area.
Okay. Thank you. Member Schaefer?
Yeah, and I think that these are the ones that the state MCOs are, and so you pretty much kind of need to have them for the state MCOs, so.
Good point.
Any other questions? Not, I'll call the question. All in favor of items D1 and D2, please say aye. Aye. Opposed? Motion's carried. We'll go on to the report of the Finance Committee at this time. Chairman, Member Metzger.
Thank you, Chairman. Finance Committee has 2 items to be presented this evening, I believe. Yes. B1A, request approval of an ordinance amending designation and operation criteria in the Bloomington Normal Enterprise Zone. That's found on page 158 through 171. And that is a final approval on those changes that we approved earlier. All the other municipalities and impacted counties have already approved this. We are the last to approve this. And I move.
Motion by Member Metzger. Is there a second? Second by Member Solner. Comments or questions? I believe we have, 4 counties involved with our enterprise zone agreements with the state. Member Woolrab.
Thank you, Mr. Chair. Question that's come to me from several folks is how, and I know we're already doing some of this now with our other agreements, but how are the numbers that are cited in the agreement, like numbers of, and wages and, residency and apprenticeship program and those, all those kind of things that are requirements of various, depending on how people apply for this, but, how do we verify those things? Who does it and how is it done?
I believe our Economic Development Council verifies it, and they go through audits and go out and verify these, and then they have to verify them and turn them into the state for approval.
So they do then, the state then, does the state also verify it, or they just send the numbers? the
Basically,
information
yeah,
to the state?
they approve, yeah, and then it's passed on to each county to vote on for approval as well. We just had a recent one with Ferrero, as you may recall. Last year it was an extension of an enterprise zone. There's only so much of area with enterprise zones that are allowed by the state. Anyone else have anything to offer? Okay, so we have a motion and a second. Any other comments or questions? Not all in favor, please say aye. Aye. Opposed? Motion has carried. Member Metzger, you have the floor.
Yes, we are moving on to B1B, request approval of an emergency appropriation ordinance amending the McLean County fiscal year 2021 combined annual appropriation and budget ordinance for the American Rescue Plan Fund 0163. Those documentation is found on page 172 through 173. This was not passed by the Finance Committee, and I move that we bring it forward.
Motion by Member Metzger. Is there a second? Second by Member Soldner. Are there comments and questions? Let me begin by saying I hope that we can come to some resolution on this. I know there are many approaches and ideas, and so I'll open the floor for discussion. Anyone have any comments or questions to vote on this? Member Woolrab?
I guess I'll just reiterate what I said at Finance, which is I really struggle with this kind of situation where we're trying to incentivize people to get a vaccine that's a life-saving vaccine, could in fact save their lives or the life of a family member, and not only incentivizing, but $1,000 incentive. And I have some other things I could mention about this, but I just think this is not the right approach to ensuring that people get vaccinated. And it's just, then I find out, or it's my understanding, I guess I'll say, and Ms. Taylor can correct me if I misunderstood what she said the other day, but that this in fact incentive would have to go to anybody who was trying to opt out of it, or and so I don't understand, how that is truly an incentive for getting a vaccine. So I'm going to vote no.
I'm going to call on Ms. Taylor to give more information on this. I think we were all kind of lacking in all the information and guidelines that came out of this for the federal government with the funding for this. And then I have some comments that I would like to talk about as well. Thank you. You have the floor.
Thank you. Thank you, Chairman McIntyre. So it is correct that this action item is in relation to incentivizing our McLean County employees, all employees, to become vaccinated and to incentivize that through our ARPA funds. Recipients may use coronavirus state and local fiscal recovery funds for expenses specifically related to vaccination programs. And those programs can include incentives that reasonably expect to increase the number of staff being vaccinated and to motivate people to do so. So we thought round and round about this subject, and the best way to look at our staff, our employees of McLean County. The issue of premium pay or bonuses, as discussed by Ms. Michael, would be a separate issue from this. But in this specific topic, we were looking at it from a number of angles. One being that since those incentives are allowable to use for the funds, we thought that this would be a benefit to our employees, much like other benefits that we provide. So we provide benefits to our employees for other wellness incentives, such as a deductible that's reduced if they have a physical and complete a physical and a health risk assessment. We have points that are earned by participating in wellness courses and other physical activity tracking that can be redeemed for merchandise. We have incentives for scheduling procedures at facilities that have a preferred provider agreement with our county's self-funded group health insurance plan. And so we would consider this as part of that to protect our workforce, to reduce the number of employee absences in relationship to COVID, to protect the public that enter our buildings and come in contact with our employees, to reduce the likelihood of major claims that would be related to COVID, and that would be against our self-funded insurance plan. I know that the average hospital stay is between $1,500 and $2,500 a day, probably more if you're on a respirator or a vent. I do know that when we checked with our benefits provider, they stated that we've spent about $42,000 out of our fund in relationship to COVID thus far. And so we felt that this would be a way to incentivize staff and also reward staff for getting vaccinated. The definitions, and what I wanted to explain further, is the definitions of eligible workers and essential workers, essential work, premium pay. You've heard those terms discussed in different formats, and those all have different definitions that are specific and separate from what we're proposing in this agenda. And so the only other point I think I would make in regards to this is that we would have to make some sort of a determination for those who have a medical exemption or a religious exemption. So it's not someone who opts out. So if you opt out of this, then you're opting out of the incentive. If you have a medical restriction and is signed by a doctor, for instance, if you're going through chemo right now and your doctor does not recommend that you get the vaccine, that would be a medical exemption that would require a signature by a medical physician similar to FMLA. And that person would still be included in this incentive. And so it wouldn't be for those who just opt out. And I probably didn't make that as clear as I could have in the Finance Committee meeting. And so that is the program that we are proposing today. There would still be an opportunity to propose a different sort of incentive to staff for working through COVID.
We talked about this all day in our office, various people coming in on the phone and other people as well. There is no perfect solution because it's a complex issue on whether or not we're trying to reward all of our employees or not. And it's difficult to determine exactly, the number of risks. I mean, some things notes that I just made, I'm trying to look at this from a different angle. I basically understand the philosophy why reward somebody who should be doing it already, as Ms. Woolrab has said too. As a teacher, over the years, we were required certain vaccinations, and we had to go in. If we didn't, we weren't going to get a job. We just weren't employed. And it was accepted. Nobody questioned it. We didn't publicly come out in meetings like this and say, whoa, why did we have to do this? Certain organizations require, some don't. If you look at, see who's rewarded different employees for doing it, I have a whole list. It all goes all the way from $50 to $1,000 from different organizations that kind of studied it well. I totally believe that anybody that was involved in working with the public should have been vaccinated. That's just my own philosophy, and we all have different ones in this room, that there should have been a mandate for us as county employees, as public employees. Because of the fact of testing costs and hospital costs we incur otherwise. I also believe that from the standpoint of having been a former armed service member, and that there was hazard pay, combat pay for special risks that people did take. And we obviously appreciate all of our healthcare workers and frontline workers and things, people that were involved. And so there was a separate, as we passed last month, there was a separate funding from the state that came down for our nursing home employees. That's not the case here, so Lori, I think this is the next best thing. Looking at it from that angle, as a mandate, at least we are. At least it's difficult to look at it that way, but at least we are actually giving some of the money that is dedicated. Secondly, it is federal money that is dedicated for it. People say, why should we go out and spend people's tax money for this as employees? Well, two things. Number one, this is not a tax that we impose. This is federal tax that was going to be distributed anyway, okay? Number two is I lost track of this. It's for the health and well-being of all of our county employees, because any exposure to people that were not vaccinated that are coming to work and so on becomes an issue, not only a financial issue, but a well-being issue as well. We also, 2 years ago, did not give our employees any raise. This year, we're getting a combination of a couple pays, but maybe 1% to 1.5%. At least there's an opportunity to reward some of them in some way. So as I see it, it's not a perfect solution, but there's more to it than just to come and say, well, why should we pay someone doing something that they should do? We're paying them a lot for other things that they should do as well. Mr. Martin.
Thank you, Mr. Chairman. I've got a question and a comment. Do we know what percentage of our county employees are currently vaccinated? Any ideas?
No, we do not have that figure.
And my comment is that I know of one organization that is in town that just awarded $500 per person to, because they did get vaccinated.
Yeah, and then there is the other side of the coin, the vaccination incentive part of it is too, because that benefits us all. Our county employees are also exposing the public the whole time, which is another reason I think that they should have something. So, Mr. Erickson.
Thank you, Mr. Chairman. Question one, I don't know who this should be directed to. The nursing home, we already approved funding to give incentives to employees at the nursing home, is that correct?
Yes, and that was under guidelines with money provided by the state.
Okay, so that's
Separate funding.
completely separate from
Yes,
this?
it is. Uh-huh.
Okay. Well, the reason I ask that is, one, I do not agree with the statement that, and I do this respectfully, so, you know, I mean, we can always respectfully agree to disagree around here, and if we can't, then possibly we shouldn't be here, but,
By the way, I'm smiling.
I know, I appreciate that. You know, I don't know how, we can't make the statement, I don't think I think it's too broad to say that, well, and maybe we didn't say this, so maybe I misheard it, but, you know, how do you prove where someone got COVID? You really can't prove it came from a McLean County employee. I mean, you just can't prove how someone got COVID, so a little bit hesitant with the rationale that we don't want our people getting COVID to someone else because, you know, there's no way to prove that. But, you know, I mean, last month with the, when the finance committee approved it for the nursing home, I can understand that you can't get COVID in a nursing home. You just can't have it there. But I just don't generally agree with having an incentive, and my rationale is completely different than Lori's, although we voted the same way, I think. My rationale is I just don't approve giving an incentive to get a vaccine. I've been vaccinated. I wish my employer would have given me an incentive, but my employer wouldn't give me any incentive to get a vaccine. But, you know, but I've been vaccinated, so, you know, so anyway, I just don't agree with the concept, so.
The very quick response, there obviously, that's why it becomes a complex issue, because we have such a diverse organization of types of employee groups that we have. And everything from people that work outside a lot to the exposure risk to the point, but we have a number of people from our health department alone who work constantly with people personally, you know, just giving vaccinations and being exposed to the public from that standpoint. So it's difficult to determine. I very much understand that. Sometimes it's difficult to justify everything, but there is a way, there is a mechanism here where we can not say no to our employees who have been responsible. Member Solner. Thank you, Member Erickson.
Thank you, Mr. Chairman. I just, a couple questions. The first, do we have a number on how much this $1,000 per employee is going to cost?
We have budgeted $725,000 to cover the totality
Okay.
of our staff.
I saw that number. I wanted to make sure that was correct. My other question is, okay, so what happens when they get their 2 shots and they decide, I don't want my booster? Are we going to have to incentivize that? And then a year from now, when we have to get another booster or another series of shots, are we going to incentivize that? The problem I see is this could go on forever. Now, when the time is appropriate, I'm going to suggest or recommend a hazard pay, bonus, whatever you want to call it, when that happens. And I don't know that I'm going to oppose this incentive, because I think it's important to get people vaccinated, and if this is what it takes, but I'm just concerned what we're going to do in the future when people are lined up waiting. I'm going to wait till we get our next incentive before we get my next shot. So that's just my concern. Thank you.
Anyone else? Member Schaefer.
So this is for the employees that have already been vaccinated, they would get something too. And basically, like other companies have done, like what Mr. Martin said, was one's given $500. There's another, like Delta Airlines or something is charging more for their insurance for people who have not received a vaccine, which you mentioned the cost of hospitalization and things like that with COVID. So there's various methods that many different organizations throughout the country are using to try to incentivize their employees to get vaccines, because the more people that get vaccinated, the better off we all are. So I can support this because it's like, you know, get a vaccine, here's $1,000, you know, I mean, if you want it. And to Member Solner's concern about booster shots, I think the initial, if you get your doses and you're, after the 2 doses, you're considered fully vaccinated, or the 1 dose of J&J, then you're vaccinated. And I would never, well, I wouldn't say never, because you don't ever want to say never, but I don't think that's going to be an issue on booster shots and things like that, because then it's going to be like, did you get your tetanus shot? How long ago did you get a tetanus shot? You know, because you're supposed to get them every 10 years. How many people really know when they received their last tetanus shot? You know, to that kind of thing. So I can support this for what this is.
Thank you. Member Erickson?
No, it's just my belief, and whether it's wrong or not, I guess it'll end up being wrong. We'll see what history shows, but I just don't think we're ever going to get rid of COVID. It's here to stay. It's going to be like the flu, and we're going to have to get a booster shot you're going to have to get a booster shot every year, and I think that's coming. And I just think that's where we're at, and I do agree with Jim's rationale. Pretty soon, you're going to have to give everybody a booster shot, give everybody incentive to get a booster shot. And I think that since COVID's here to stay, you know, we're going to have to give everybody a booster shot every year. We're going to have to give everybody an incentive every year.
I think to answer your question, Jim and Chuck, this is a one-time incentive. It's a one-time thing. This is funding that was specifically spelled out with guidelines from the federal government for us for this time. If there's any other time, it'll have to come from them, because we're balancing our budget and doing what we always do here, and this is just an opportunity to do this for our employees. I hate to say no to our employees on this, especially for the ones who have actually been responsible to get this done. Regardless of the philosophical differences on that, it does impact us all. It impacts our health insurance costs, it impacts our health. I don't know if you saw, I think, did you talk a little bit about the individuals who have had situations in our county? I thought I had that someplace.
Are you speaking to the other businesses who have
Well,
addressed
no, the
it?
individual who maybe has had COVID and has been in the hospital for a certain long period of time, and an amount of money that is required for them to have to be with our out-of-pocket costs, and then in fact it's going to have on insurance rates. And we're talking, which one was the example that we found somewhere? Do you have that one?
So I do,
Have it with me.
I do have a couple of bullet points from our health benefit specialist.
So you'll know, we called today our health benefits specialist and saw just to see what kind of, give us some feel for this as far as situations that may have happened here in county, within county employees. Excuse me, go ahead.
So I'd like to address 2 points, but the first one being the chairman is speaking about our stop loss, I think, with
Yes.
The total amount that would be necessary to cover an employee who perhaps was gravely ill with this virus. Our stop loss is 150,000, and so that would be the amount per person that the self-funded health program would pick up for those costs. The insurance average cost being reported for someone who needs to be hospitalized with COVID, obviously some of those cases are not as severe. The average cost is being reported at $24,000 for each individual. Mr. Gilmore does know of someone in the community who has been in the hospital for much longer than that, and those costs obviously would go beyond our stop loss. So those are the concerns as far as the cost to the county in responding to this. As we know, 90% of those who are being hospitalized, according to what you hear from hospital organizations and what's being reported to the press, that those are the people that are being hospitalized more frequently is people who are unvaccinated. Um, the second point that I would bring up is that, yes, this is all new. We have not incentivized staff to get vaccines before. We also have not given extensions on our personal time when they couldn't take time off. We've made lots of concessions through COVID. Work from home, varying schedules, social distancing, changing work patterns, all of this, locking down buildings. All of these are brand new ideas based on responding to this virus. Um, and so, yes, this is new territory. We have not seen it before. We have not addressed it before, and there is not a lot of information out there on the best practices on how to respond. I do know when we did a cursory search of the community to see how businesses were responding, several businesses are giving incentives of varying amounts. They may also be giving, instead of a cash incentive, they may be giving the equivalent of so many hours of work, 2 hours of work, 4 hours work, 8 hours of work, in incentivizing that. So there are many different ways to address this. The other consideration that I have thought of in responding, no matter how we go forward, is for those who still opt out. Testing, the Binex testing is going to be getting more difficult for us to receive, according to our health department. And so my other consideration of this is moving forward, how will we address that? How will we find staff to cover those shifts to make sure that those that are unvaccinated are receiving weekly testing or are staying safe, especially in our healthcare field. The option right now is you are either vaccinated or you are tested weekly. And so looking at that concern, we felt that this was a way to increase our total vaccination numbers and assist our employees while also giving them a carrot instead of a stick.
Thank you. Any other comments or questions? Member Metzger.
I just have a question on employees. The definition of that, does that include elected officials?
I'm
Yes.
assuming if they're on the payroll, they're considered to be employees.
Should this pass and an elected official is to get this, I will not take $1,000.
You're talking about county board members or
Yes.
employees? Well, we're just part-time employees here.
So if we don't get, part-time, full-time, I don't know. I'm just saying that as an elected official, if this is offered up to me, I will not take $1,000.
I was assuming we were talking about our full-time FTE staff members only. Is that correct?
So we were not going to include those staff that worked less than 600 hours a year in this incentive.
Okay, thank you.
Anyone else? Member Woolrap?
Thank you, Mr. Chair. So I want to make it clear that I'm very, very much in favor of a vaccine, if I haven't already done that, and I have been vaccinated twice myself. I just think that if we're using this to sort of pay back employees because we maybe feel like we didn't quite give them enough money before, I think the proper way to approach that is through the salary survey that we're planning on doing and making proper adjustments as we can going forward. That's the proper way to pay people for a job that they do. I also feel that this is not because, this was not an issue. None of these concerns came up, to my knowledge, back in February when the vaccine first became widely available. And so 3/4 of a year later, now that we have some federal funds available, which are obviously not local funds, but nonetheless are taxpayer dollars, all of a sudden this is a concern for us. We didn't care before when people could have gotten it, but now that we have money that we don't have to speak up for and tax locally for, now we can hand it out. And finally, these people, there are plenty of people in the community that have frontline exposure, and are not going to get $1,000 as a reward for getting vaccination, and yet we're using their tax money to reward other people. And I just can't do it.
My response would be that we did care before, but we did not have the money before to do that unless we did tax locally for that and go out and put a special tax on something like this. As you know, we work every year to try to balance our budget and go within our means, and this would not be a way that we could have done that. There are always special taxes that could be imposed. We don't have the authority to do some, as municipalities do. But I don't know that we didn't care. I mean, it's a matter of opinion, of course, but just try and do the right thing here for what we do have. This is in a situation where we do have an availability to do something that would help our employees. And also the employees who have done something that have not incurred extra costs on us and have not incurred extra risk to the public or to our fellow workers. Member Erickson.
Thank you, Mr. Chairman. I would respectfully that I'm not doing the right thing if I vote no. It's just my philosophical view that this is not the right approach. And to say it's a tax here, it's a tax there, it may be a tax at the federal level, it won't be a tax at the local level, but somewhere there will be a tax or some way to have to recoup that money. But I do have a question. You said you went and got the numbers on COVID and what it could cost what it could. What about the flu? Did we get numbers on the flu too and what the flu does?
I did not request that information today.
Okay. I mean, and how did we come up with 1,000? What was the basis for the 1,000 as the incentive?
Well, it was not very scientific, but we did do a cursory review of staff to ask them what they would feel would incentivize them to get the vaccine. And so we started out with a low number, and the lower numbers were considered not persuasive to change people's mind if they were certain, if they hadn't received the vaccine already. And so we wanted to make it impactful, and we also thought that this would be a way to also recognize all those that had worked through COVID that may not fall under some other determination. And so the difficulty in giving a premium pay to one group of staff is that it is not something that is eligible to all. And in our policies for considering pay to our employees, we look at what is equitable and what would be the good of the morale of our staff. In our budget policy, we state something similar to that. And so that was how we came up with that number.
So let me
It was
see if
arbitrary.
I understand. When you talk about premium pay, you're talking about all employees, all county employees, correct?
No, not all,
Okay.
not all would be eligible for premium pay.
Who would be eligible for that then? I mean, there's some guidelines here that I'm missing on this about who is eligible to get paid for this money.
Vaccine pay, the vaccination pay, all staff that have been vaccinated would be eligible. Premium pay is a different determination that is not a part of this agenda item. That would be the pay related to direct work. Let me see if I have that
Is that the
definition.
essential worker definition?
Well, let me see.
I know that staff wrestled with this and, before.
So so there is some confusion between all the different definitions. So eligible workers, that's the highest level of category. So that would mean that all county employees are eligible workers. They worked through the COVID pandemic. They are included in the category of workers such as hospital employee, nursing home employee, government worker. That does not mean that they qualify as essential work under the American Rescue Plan for premium pay. So to be qualified for premium pay, that essential work means work performed that is not telework, is not working from home. It would involve regular in-person interaction with patients, the public, or with other coworkers who have had direct contact with the public, or physical handling of items that were handled by patients or the public in performing that work. And so there would be very specific parameters around that premium pay related to essential work, not just being an essential worker.
What are the difficulties with determining that? Or are there difficulties? It was kind of discussed about who would qualify then, who would determine who could qualify.
I believe if we went that route, the determination would have to be made by their direct supervisors as to the number of hours that they worked in direct relationship with the public. And as you can imagine, some departments would be quite easy to determine. I would know that a nurse or a CNA has had direct contact with a resident or a patient. Other jobs would be more difficult to determine.
What other problems would there be with that? Would there be problems with dissension or fairness or one department chairman determining more so in favor of all their employees compared to another one? Just being realistic, with the questions.
Yes,
How do you see that?
Well, when we were determining to first introduce the vaccination pay, it was with the thought of employee morale and the principles of equity. And those principles of equity would be applied differently in regards to essential work and premium pay.
Any other comments or questions? Member Metzger?
But this particular situation is identified very specifically that this pay can be paid to incentivize people who get the vaccine. This other conversation is not related to this at all. Is that correct?
Correct. This
Thank you.
motion is only for vaccination pay.
Erickson?
I'm sorry, Mr. Chairman, just another question. What did this have to do with Kathy Michaels' issue? Does it have anything to do with her issue? Because I couldn't, it has nothing to do with the same thing she brought up, right?
Her memo that was sent to board members was in relationship to premium pay for essential work.
Okay.
The statement she made here sounded like she was speaking on behalf of all employees to receive an equitable pay.
Because did we deny something? Well, I'll ask at that another point. But one last statement I just want to make. I mean, if you were to vote no, it's not because you're opposed to the vaccine, because this is an individual who got the vaccine and actually did a public service announcement that people should get the vaccine. It's not opposition to the vaccine, it's just opposition to an incentive.
Okay. Anyone else? Member Schaefer?
Yes, if we're going to get through this meeting, I'd like to call the question, please.
Okay, question's been called. Any objection? If not, then we are voting on a request of approval of an emergency appropriation ordinance amending McLean County fiscal year 2021 combined annual appropriation and budget ordinance for the American Rescue Plan Fund that is found on pages 172 to 173. All in favor say aye. Aye. Opposed? So we have 1, 2, 3, 4, 5 recorded yeses.
Can we have a roll call vote, please?
Roll call vote we can have. If someone can call a roll. Ms. Morlock will call the roll.
This is a roll call vote for the motion to recommend approval of an ordinance. Oops, hang on, I'm in the wrong section, I apologize. On 4A, no, 4B, 1B. Member Martin? Yes. Member Barnett?
Yes.
Member Metzger?
Yes.
Member Woolrab? Member Schaefer? Member Erickson?
No.
Member Soldner?
Yes?
Chairman McIntyre, do you want to
Yes.
vote? Thank you.
Okay, the motion then has passed. Do we have any other items?
We have no other items. We will have 3 items to present to the county board.
All right, thank you. We'll go on to the report of the Health Committee, Chairman Schaefer.
Thank you, Mr. Chairman. The Health Committee has no items for action today, but we will have a couple items for the board next week. Thank you.
Thank you. Report of the Justice Committee, Chairman Erickson.
Thank you, Mr. Chairman. The Justice Committee has 2 items for action. The first item is 4D1A, request approval of an amendment to the grant agreement between the Illinois Association of Court-Appointed Special Advocates and CASA of McLean County. Did I move that or?
A motion by Chairman Erickson. Is there a second? Second by Member Schaefer. Comments or questions? Discussion. If none, all in favor, please say aye. Aye. Opposed? Motion's carried.
Next item on the agenda is item 4D1B, request approval of a grant agreement between the Children's Advocacy Center of Illinois and Children's Advocacy Center of McLean County, and I so move.
Motion by Chairman Erickson. Is there a second? Anyone? Second by Member Metzger. Comments or questions or discussion? I'm sorry, I didn't look over that way. All right. Member Martin, nice to see you. Any comments? All in favor, please say aye. Aye. Opposed? Motion carried.
Mr. Chairman, we do have several items that will be presented to the board. Thank you.
Thank you. We'll go on to the Land Use and Development Committee, Chairman Went, Vice Chairman Woolrab. I'm sorry, you're not Vice Chairman. Land Use.
Me.
I'm sorry, Mr. Solner.
Well, luckily for you, we don't have any action
Okay,
items
good.
today. I'd be glad to answer any questions.
Thank you very much. I'm sorry, going back for your Property Committee report, Chairman Barnett.
Thank you, Mr. Chairman. Before I bring this forward, I just would like to apologize to you and to the committee for my tardiness, despite the fact that I put on my calendar that this meeting now starts at 4 o'clock. My mind still thinks it starts at 4:30, so apologize for that.
Absolutely understood. As you can tell, my mind still thinks who's chairman and vice chairman of the committee, so.
Property brings forward item 4F1A, request approval of an emergency appropriation ordinance amending the McLean County fiscal year 2021 combined annual appropriation and budget ordinance for the Facilities Maintenance Department 0041, and I so move.
Motion by Chairman Barnett. Is there a second? Second by Member Woolrab. Comments or questions? Any discussion? Hearing none, all in favor, please say aye.
Aye.
Opposed? Motion has passed.
Thank you, Mr. Chairman. We'll have several items for the board on Thursday night, and that concludes property.
Thank you very much. We'll go on to the report of the Transportation Committee, Chairman Solner.
Thank you, Mr. Chairman. Transportation has 2 items this evening. G1A, amendment to Chapter 300 Roads and Highways in the McLean County Code. This is without the support of the Transportation Committee, and it's dealing with golf carts in the village of Hudson, and I make the motion. I so move.
A motion by Chairman Solner. Is there a second? Second by Member Barnett. Comments or questions or discussion? Member Erickson.
Yeah, why did the Transportation Committee oppose, why are they opposed to golf carts?
Okay, may I proceed, Mr. Chairman?
Yes, sir.
With the advice of our Sheriff's Department, our county highway engineer, and the Regional Planning Commission. They found the liability towards the county was too much of a risk. Right now, there's in state statutes, they're allowed to cross a county highway, but they're not allowed to drive down a county highway. And there's a couple of main streets in Hudson that are county highways. They also have a new Dollar General, and so there's residents that would like to be able to drive their golf carts to Dollar General. And there are parts of town where you cannot access any other roads without going on a county highway. So we are continuing to work with the village of Hudson and Hudson Township to see if there's a alternate, either by way of maybe similar to a bike trail or a walking path or whatever else we can do to help them. That would mean getting some right of way, and again, hopefully we could do that. But there's just too much risk at this point to allow them to drive up on the main county highway.
Are you the chairperson of the Transportation Committee? But you moved to support this, even though.
Only to get on the floor.
Oh, you're trying to move it to get it forward,
Yeah.
okay. Are there other communities in McLean County that allow golf carts?
Not legally on their streets, not that I'm aware of. Again, they're allowed to cross the county highway, but not drive on county roads.
I think the key issue there is county highway. Member Metzger?
There are other small communities that have golf cart use on their village streets, and they do cross-county highways. One in particular is Carlock. However, no one except Hudson has made the request to allow to have golf carts on county highways. And as Chairperson Solner said, it's primarily because they have two major highways that run through the village, and certain individuals, based on where they live, can't even own a golf cart, or will not be allowed to have a golf cart, because the only way that they could use it is to get on Broadway or Franklin. There are ways, Member Thompson and I have met, went out and had an afternoon in Hudson, and there are ways around it. I will tell you that. But there hasn't been support from our sheriff, nor our transportation committee, or the regional planning commission. Based on that, I believe, I was at the meeting, it was voted down unanimously. Is that correct?
It was, and again, as we mentioned at that meeting, it's not necessarily a dead deal. If we can come up with something else, and we can always, some member could also bring it back up. But at this point, we just felt the liability was too high.
I'm just gonna ask for roll.
Okay, thank you. Member Schaefer?
I need some clarification here. On pages 191 through 194, is that what the Village of Hudson had proposed to us? Is that what I'm reading correctly?
I believe the first part, I believe, is, some of it is semi-new language. Unfortunately, in some of the documents, it's the lines that were written in blue, and I don't have any blue, I have black and white.
Yeah, right.
But in general, the biggest part of the document is state statute or county statute. Again, the first page pretty much, I believe, is a general part that was provided by Hudson.
Okay.
I mean, Administrator, if I'm not correct, you can correct me.
Thank you. So at the bottom of page 191, there is in bold, it says permit requirements. The paragraph before that starts, be it further ordained, you may be able to see, it looks like it's a little bit lighter in shade. That is the start of their new proposed language. And then that goes through all of page 192 and 193.
Okay.
And the majority of 194. So inside of the Hudson Village, they have their own ordinances on golf carts, and they adopted those into ours.
Okay. So then my next question is, and when we vote, are we voting to approve this against what transportation said? So a yes vote would be to support this, and a no vote would be to support what Transportation Committee did?
I believe that's
Is
right.
that correct? I just want to make sure I know which way I'm going here.
That is correct. If you vote no, you are upholding the Transportation Committee's
Yes, of course.
recommendation to not move it forward, to not support it, the change.
So voting no would be not allowing the golf carts, and voting yes would be to allow them.
Yes, and that is to travel on the county highway within the city limits. The town of Hudson has their own ordinances and approvals and requirements for golf carts. I have two questions for you, Mr. Solner. One is, it says here their proposal is in speed limits under 30, as I see at the top of
That's correct.
bottom of
Mhm.
191. Is that correct?
I believe.
And can anybody tell me, do you know, are bicycles allowed on county highways?
Unfortunately, I guess that's part of the rub. They feel like a bicycle may not be any safer than a golf cart, and I don't know that I disagree with that, but that is a state statute. And so if someone can convince the state legislature to allow a golf cart, then it would be a lot easier for us to deal with, because then the liability wouldn't be quite as much.
Since many of us aren't on the Transportation Committee, although I have watched that, is there anything about the speed limits that come into the town of Hudson on the county highway? I know, isn't there a 40 zone as well? Are
Yes,
they-
there is
Are
on
they
Broadway.
they're excluding the 40 zone?
They
then?
do not allow any golf carts to the south on Broadway where the speed limit is increased. It is only from the speed limit from 30 north onto Broadway.
Okay,
All of Franklin, most of Franklin, I believe, while it's in the village, is 30.
30, okay.
So that's why Franklin is the street that goes east and west. Broadway is basically Linden that comes into.
At the current time, the practice has been that they can cross the county highway. It's not drive on it, and that seems to be allowable by the county?
Yes, the county allows that and has allowed it.
Yeah, that is in our
Yes. Okay.
regulations
That's
somewhere.
all I have.
And you know, the other thing is, you know, in the little hamlet of Ellsworth, we don't allow county or golf carts on the county highway, but, you know, you gotta have somebody that's gonna police it. So occasionally you'll find somebody that's going to church or to the post office or whatever, and technically they're breaking the law. So, that to me is also another issue. If you allow it, then all of a sudden you have to have somebody that's gonna police it.
Okay, any other comments or questions? We'll move on. Yeah, member
So
Erickson?
there are towns that have, they do it, they just can't cross the county highways. Or there's no town that has any ordinance that allows for a golf cart.
Correct. There's no town that's allowed to have a golf cart on the county highways other than crossing them.
But what about if you're just driving on the city highway? You're not.
You can,
you're
Yeah.
not
you
crossing-
can drive on any city street if it's
Yes.
allowed in the village.
Okay, so
Incorporated
there
area.
are villages that do allow them on the city streets right
Correct.
now. Okay,
Yes.
all right, I still call for roll call, so.
Yes, okay. Well, okay, any other comments or questions? If not, we'll have a roll call vote. A yes vote is to approve golf carts, the amendment. A no vote is basically to not approve, which would be the same as the Transportation Committee did. Does everybody understand that okay before we vote? Okay, we'll have a roll call vote. Morlock?
Member Martin,
No.
Member Barnett,
No.
Member Metzger,
No,
Member Woolrab,
No,
Member Schaefer,
No?
Member Erickson,
Yes.
Member Soldner,
No.
Member McIntyre.
Yes. So we have, what is it, we have Six no votes, 2 yes votes, and so the motion fails. Okay, move on, Mr. Solner.
Thank you. Next item is G1B, request approval of an intergovernmental agreement with the Board of Education of Redview Community Unit District Number 19. This is for a solar-powered flashing school zone light, I believe it was, yeah, school zones, and for 2 of them. And the county is going to pay for the post and the sign. The school district is going to pay for the solar part and the flashing part, and I make that motion.
A motion by Chairman Solner. Is there a second? Second by Member Wolrab. Comments, questions, or discussions? This is very similar to what we have done in Carlock and also out at Olympia. It's just a safety move for the county. If there are no questions or discussions, all in favor, please say aye.
Aye.
Opposed? Motion is carried.
That's all that we have in transportation. I did want to comment that we had a good discussion as well as other committees on the budget process, and I'd be glad to answer any questions.
Thank you. We'll go into the report of the county administrator, Ms. Taylor.
Thank you, Chairman. My first item to be presented for action is to request approval of a resolution of the McLean County Board continuing the disaster declaration for COVID.
Is there a motion to approve? Continue the resolution. Motion by Member Wolrab. Is there a second? Second by Member Martin. I've got to turn and look this way. Any comments or questions or discussion? All in favor, please say aye.
Aye.
Opposed? Motion is carried.
Thank you. And moving on next, the remainder of my action items are related to our budget. That begins on page 203. The first being item 4H1B, request approval of the Regional Planning Commission budget. And I do have a couple of slides, very brief, to present following a motion.
Please continue.
The McLean County Regional Planning Commission is designated as an NPO for the Bloomington Normal Urbanized Area. They recently celebrated their 50th anniversary in 2018. They are mandated to be part of the McLean County's single audit due to regulatory changes in 2018 to GATA. Their fiscal year does match the county's fiscal year, which makes things a little smoother. And their budget was approved by the McLean County Regional Planning Commission on September 1st of this year. Their budget revenues are, many of their revenues come from grants. As you can see there, they have community development block grants from Bloomington and Normal. They have Federal Highway Administration grants, Human Services Transportation Plan funds from IDOT, state metro planning funds, and regional service agreements with Bloomington, Normal, Connect Transit, and the county. Their expenditures are as follows. 61% of their budget is for salaries, 3% for supplies, 35% for services, and 1% for capital assets or projects. And that is the extent of my PowerPoint on this department.
Mr. Lai is in attendance. Is there a motion to approve? Motion by Member Barnett. Is there a second? A second by Member Wolrab. Are there any comments or questions at this time? Member Metzger.
I do have one question, and that has to do with payroll. I think, full-time employee salaries, which is 0503.0001, found on page 203, I believe. And there's an 81% increase. Can you just tell me why, what the change was? That, did we have an employee leave last year and we replaced, I don't know.
You wanna go ahead?
we're going to refer to Mr. Dryer for an answer, right?
So, as an agency with multiple grants, they move personnel around in between grants. So you could see other salary lines where it went down.
All right, thank you. Any other comments or questions? If not, we'll take a call of question. All in favor of the McLean County Regional Planning Budget, please say aye. Opposed? The motion is carried.
Thank you. Next up is request approval for the fiscal year 2020 recommended budget for Information Technologies Department. And I think my slides are out of order. There we go. This would include subdepartments for data processing as well as for the county GIS system. Our IT budget serves all county departments for technical support ranging from the help desk and level 1 issue resolution to project planning and management, and also any technical media issues that we have with regard to our county board and county committee meetings. Their overall budget is as follows. They have 48% of their overall budget allotted to salaries, 8% for supplies, 39% for services, and 5% for projects or capital assets.
Okay, is there a motion to approve the IT budget? Or should, yeah, sorry. Motion by Member Metzger, is there a second? Second by Member Martin. Comments or questions? Member Metzger?
Yes. Not objecting, just need clarification. There is 154,000 and an additional 6,000 for equipment. Is that accurate?
Could you identify which page you're on?
Page 213, under, I guess, is that, it's an expense, total expense of $154,395. It is a 388% increase from last year. I'm just,
So that is in the county GIS services line. That's the total amount for services for GIS. So all of the 700 line items in that account. And I believe that there is a flyover scheduled for this coming year, 2022, that would indicate a need for an increase.
Thank you.
And
Are there
then-
are comments and questions?
then we have in 0833.0020, just a couple of lines later, 111% increase, and that is for equipment. Is that also, that's,
Yeah, so that's computer equipment, and that went, the amount was raised from $2,844 to $6,000 for additional computer equipment. I would have to ask IT staff to tell us that specific
Member,
equipment.
Mr. Nelson
I
is here in
believe it's the
attendance to be
plotter.
happy to come up.
It's the plotter.
The plotter? Kathy Dryer believes it's for the plotter for GIS. Correct.
Yeah,
That's correct.
okay. Any other questions? Hearing none, I'll call the question. All in favor of the budget, please say aye. Aye. Opposed? Motion is carried. Thank you, Mr. Nelson. Go on to item D.
Item D is request approval of the fiscal year 2022 recommended budget for shared sales tax municipalities budget 0007. That would include our mental health programming and non-departmental programming in that line. So for a budget overview with this budget, our salaries included in this budget would be the FUSE program staff as well as the triage program staff. Transfers to other funds would include the debt service on the jail addition, which is 1.1 million and included in an intergovernmental agreement to that effect. And then criminal justice, mental health, 570,000. Capital assets would include the case management system acquisition. We have referred to that as Aegis in many of the other conversations before the county board. And then for services, it would be mental health contractual services outside of the county, as well as miscellaneous contract expenses.
Is there a motion to approve? Motion by member Schaefer. Is there a second? Second by member Martin. Comments or questions or discussion? Hearing none, I'll call the question. All in favor of item D, please say aye. Opposed? The motion is carried.
Item E, request approval of fiscal year recommended budget for county board fleet. That is on page 219 in your materials. I did not prepare a PowerPoint for this budget. It is for the costs for the purchase of vehicles for all of our departments that were requesting vehicles this year. And so it includes several departments in our individual oversight committees. When we came to this item, we would indicate if that had been moved to the fleet budget.
Understood. Is there a motion to approve? Motion by member Martin. Is there a second? Motion, a second by member Schaefer. Any other comments or questions about our fleet this time? If none, all in favor, please say aye. Aye. Opposed? The motion is carried.
The next item on your agenda, F, is request approval of the fiscal year 2022 recommended budget for County Administrator's Office, and that is on page 220. The Administrator's Office was created by the McLean County Board in 1975 to administer the policies and decisions of the board. Under policy direction of the board, the administrator also promotes intergovernmental cooperation and provides administrative services which may be centrally administered. And as you can see in the pie chart, 81% of the budget is for salaries, 1% is for supplies, and 18% is for services.
Is there a motion to approve? Motion by member Soldner. Is there a second? Second by member Barnett. Any comments or questions on our administrative budget? If hearing none, all in favor, please say aye. Aye. Opposed? Motion is carried.
And lastly, we have G, request approval of fiscal year recommended budget for the American Rescue Plan Act Fund 0163. That is found on page 222. And the American Rescue Plan total FY22 budget is $10,351,280. We have $1,587,500 budgeted for capital infrastructure projects, and $8,763,780 is budgeted for non-capital projects. 14 projects encompassing 6 building sites or departments total the $1,587,500. That includes 1 project in the government center to upgrade counter safety measures, 2 projects in 200 West Front, including ventilation and boiler replacement, 4 projects in the Lawn Justice Center, improving safety measures as well as ventilation improvement and storage, 1 project at Metcom, 3 projects at the nursing home, and 3 projects at Kamlara Park. The additional American Rescue Plan projects totaling $8,763,780 include policy software for the Sheriff's Department, 2 projects at the Health Department, including the continuation of contact tracing and a mobile clinic van for $300,000. We have 2 projects for the nursing home. We have a county clerk's purchase of new election equipment for $1.2 million. In emergency management, we have software and equipment. And then for the jail management system, data management system, storage and integration portions of Aegis, we have $6 million budgeted. And the Law and Justice Center building would be the purchase of office equipment for $46,280. That is the end of the presentation.
Thank you. Is there a motion to approve? Member Worab, is there a second? Second by Member Erickson. Comments or questions? Hearing none, all in favor, please say aye. Aye. Opposed? And the motion has passed.
I have no other items to be presented to the board.
Okay, thank you. Other business and communication. Does anyone have anything for tonight? I have one thing. I just want to keep you up to date. Our reorganization, reapportionment committees are meeting on a regular basis with our 3 chief judges in charge of our 8-person committees. Again, I'm asking and hoping that all county board members refrain from attendance so that we can keep this a fair process without any appearance of influence into these meetings. And we will be talking about this more on Thursday about our process as we move forward with that. I think things are going very well. The judges seem to be pleased, and so there'll be a point in time when we will be dealing with reapportionment when the time comes. That's all I have. I have bills here someplace if I can find them. All my budgeting process.
Mr. Chairman, I have a question.
Yes.
Thank you,
Member
Mr. Chairman. So I mentioned earlier that sometime I was going to recommend something for our employees in the form of bonus, hazardous pay. When would be a proper time to discuss that?
Solomon?
Are you asking a proper time to address your recommendations or?
Or to present a recommendation? For next month? I
We
mean,
could
is
do that next
probably-
month and I could work with you on that.
Okay,
Mhm.
all right.
Thank you. Bills presented to us for payment, regional planning, $13,431.05. A combination of our general funds, shared sales tax, Veteran Administration, American Rescue Plan, and Community Development Program, $1,126,748.30. Is there a motion to approve? Motion by Chairman Metzger, second by Member Martin. Any comments or questions? These will be included in our regular monthly meeting as part of our consent agenda. All in favor, please say aye. Opposed? Motion is carried. I have nothing else at this time, and this meeting is adjourned. Thank you for all your participation.
Half an hour to spare.